Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio is Dr. Lawrence Edwards, specialist in internal medicine and rheumatology, serving as professor of medicine in the Division of Clinical Immunology at the University of Florida in Gainesville, Florida. He's also chairman and chief executive officer for the Gout and Uric Acid Education Society. And he's here with us in studio to talk about the Gout Information Kit that's been designed for medical professionals to help improve patient disease management and overall outcomes. Welcome to the program, Dr. Edwards.
Thank you, Neal. It's a pleasure to be with you again.
Thank you. Thank you. The Gout Information Kit, is this something that physicians can have delivered to them, or is this some online course or informational source?
Well, it is both. By contacting our website at gouteducation.org, we can send out a number of things. Some of them are informational posters that, again, help dispel some of the myths about gout. But we also have patient brochures that are printed up that we send out by the box load to doctors' offices. The brochure is called About Gout, and it describes the disease itself, the various symptoms, what the causes of elevated uric acid level are. It does have a chapter on, or a few pages on the role of diet, and a discussion generally about the therapeutic interventions that we use for gout. So those are the types of things that come in the informational packet that physicians can get.
You know, you talked about misconceptions about gout specifically. I mean, as physicians, you're familiar with arthritis, rheumatoid, some of these other afflictions that are associated with inflammation. Why do you think there's so little, understanding about gout?
Well, patients and physicians focus on the acute symptoms, the very hallmark types of excruciatingly painful forms of gout. They last for a week or so, and then they resolve. And by the time the patient gets in to see their physician for their annual exam, it's 3 or 4 months behind them, and they don't emphasize it. And the doctor's not bothered because he's more worried about their blood pressure and their kidney disease and their diabetes and other things. And so it's a low priority thing. What's not recognized by both physicians and patients is how this disease progresses. If left untreated, if we're not lowering the uric acid, gout will progress into a chronic and crippling form of arthritis, every bit as bad as advanced rheumatoid arthritis, as far as leaving people incapable of using their hands and their feet and being up and walking and being independent. So it's that part of the disease that ends up in the rheumatologist's office, but aren't seen very commonly in the primary care office. So the initial symptoms, the first decade of these intermittent flares, can frequently be overlooked and not treated aggressively as far as lowering uric acid down.
Now, I understand that the Gout Information Kit is designed for medical professionals in their effort or their attempt to improve patient disease management. How much of the kit focuses on teaching the physician how to start the conversation about something that is surrounded with such misconception?
Well, we actually do that on our website. We have a number of videos that have been done by gout experts from around the country that focus on all aspects of gout, the acute treatment, the more chronic uric acid lowering treatment, and we even have ones on how physicians should be talking to their patients at the very first time about the diagnosis, about the proper emphasis on diet versus medications. And so these educational videos are contained on our website and can be viewed at any time.
Okay. Is there any, age cutoff where it presents less or more, or is this something that can come up at any time?
Well, it's interesting that men certainly get gout at a younger age than women do. There are unusual families where the age of onset is very young, so that young males might develop it even in their teenage years. But the more common picture of gout is a male in his 40s or 50s, or a woman in her mid-60s to mid-70s that first develop these symptoms. It can come on anytime between teenage years, and I had a patient just in clinic several days ago that was 92 and had his first episode of gout just several weeks ago. So it pretty much covers the spectrum.
Now, once someone has been diagnosed and they've been treated, are there things that they're going to have to continue to do at home other than, I guess, maybe reducing some of the things that raise uric acid? Is there ongoing maintenance? I guess maybe, in the same way that a person who may have a plantar wart has to shave it off periodically. Is this something that you find happening once a person has been treated for gout?
Well, we don't want anybody with gout shaving anything off.
I understand that. Just a bad analogy, yeah.
Mm-hmm. Well, we tell them in the beginning that this is a condition, the elevated uric acid's a condition that they've had for years and probably even decades, and that the ultimate goal is to get them into a state where they're having no symptoms related to the gout at all, and that can be achieved by lowering uric acid. If they have unusual diets, and occasionally I'll see patients down here in north central Florida, our nearest coast community is a little fishing village called Cedar Key, and I have several people that come over from there that they're shrimpers, and their whole diet, breakfast, lunch, and dinner is shrimp and a couple of cans of beer, and that's just about as bad a diet as you could have for somebody with gout. So in those situations, I do try and get them into a more balanced Western diet. But for the most part, we emphasize foods that can trigger the flares. They're not causing the gout, but they're triggering the flares. And this is red meats and shellfish and beer. And we ask them to cut back on those things. They don't have to eliminate them entirely, but just not to be binging on them. Then if we get them started on a uric acid lowering drug and adjust the dose of that medication to where their uric acid is less than 6, then the whole trick with gout from there on out, for the rest of their life, in fact, is to be on that medication that will keep their uric acid in the good range. And if they do that, then occasional dietary indiscretions, other types of physical activity that might otherwise flare up the disease can be done without the risk of causing the gout to become symptomatic again.
So what do you tell the person that believes that, drinking cherry juice is just as effective as taking their medication?
Well, it hasn't been well studied. There have been a couple of studies looking at beneficial effects of cherry juice and other high potent forms of vitamin C for lowering uric acid. And you can get a little bit of reduction of uric acid, but not to the point that it's going to cause somebody with gout to no longer have gout. Their uric acid level is still going to be in the elevated range, and over time, their disease is going to get worse. As far as treating acute symptoms, cherry juice does seem to have some pain relieving properties, but again, no better than the standard therapies that are otherwise used. So it may have a role. I think there's more studies that need to be done about cherry juice, but it isn't going to cure their gout over time.
Right. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us. We've been in studio today with Dr. Lawrence Edwards, specialist in internal medicine and professor of medicine in the Division of Clinical Immunology at the University of Florida in Gainesville, Florida. He's also chairman and chief executive officer of the Gout and Uric Acid Education Society. And we've been in studio today talking about the kit that's designed for medical professionals in order to help them improve overall patient disease and outcomes when it comes to the management of gout. It's been great having you here with us today, Doctor.
Thank you, Neal. It's been a pleasure.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.